Hello, folks. So we have finally come to the final examination of the orthopedic system, the MSK system, the musculoskeletal system. And like before, our common approach is wiper plus wiper plus low FEMS. So wiper plus low FEMS. With that said, what are the steps? Again, we start with gait. So walk. The interesting thing with the ankle is when the patient is walking beyond normal gait, you want to make them walk tiptoe. So something like that. Sorry, you had to see my toes. So you want to make them walk tiptoe and you want to make them walk on the heels as well. This is to help you assess the ankle joint better. So the ankle and the foot joint go together. Now, once you've done these, you want to move now to feeling. And the feeling of the ankle joint would start from as a process to it. So the first thing you want to do with the ankle joint is you want to feel for temperature. Yes, so you're feeling for temperature. So once you felt for temperature, you want to assess important pulses, and you want to assess for the dorsalis pedis pulse, which would be somewhere here, and the posterior tibial pulse. Now, once you felt that, you want to assess for the Achilles tendon. You want to ask the patient to kneel and on a stool and assess. Now, once you've done that, you now want to go ahead and think of the joints in the leg, in the ankle, and assess them. So you want to assess the metatarsophalangeal joints. You want to also assess the tarsal bones. That way, you want to assess the tarsal bones. And then you want to assess the ankle motis itself. You want to assess for any abnormality. Now after you've done this, you want to move into movement. Remember, movement is active before passive. So, and the easy way to remember the movements of the ankle is something I call P-Phi. So that's P-F-I-E. So you want to start with ankle plantar and dorsiflexion. So ask the patient to plantar flex and dorsiflex. And once you've done that, you want to go into the ankle toe flexion and extension. So ankle toe flexion, extension, flexion, extension. Once you've done that, you want to do ankle inversion and eversion. So ankle inversion, eversion, ankle eversion, eversion. Now, once you've done that, you want to move into passive. So you want to start with plantar passive flexion and extension. So you do that, you hold that for the patient and do that. The same movement like that. So once you've done that, you want to move into subtalar inversion and eversion. So subtalar inversion, eversion. Once you've done that, you want to come to the mid-tarsal inversion, eversion. Then you want to go into the hallux, which is the big toe, extension and flexion, and the toes flexion and extension. Now, once you've done all this, I think the other thing you would remember is in palpating, don't forget the calcaneus as well. And once you've done that, you want to demonstrate CMOD test, which assesses the integrity of the Achilles tendon. So you want to put the patient in this position and squeeze. You will see that, can you see? that is moving like that. So you want to do that, and that should move that way. This should conclude the ankle examination. So let's quickly recap. So it starts with look, gait in triangles, tiptoe and heel as well in the gait, and feeling along joint lines. Remember temperature, pulse, Achilles heels, the joints and the bones, movement, active before passive, and remember P5. So you have ankle plantar and dorsiflexion, you have ankle toe flexion and extension, you have ankle inversion and eversion. Now you move to passive, you have plantar and dorsiflexion, you have subtalar inversion and eversion, you have mid-tarsal inversion and eversion, you have hallux and toe flexion and extension. You have the special test, which is the CMOD test. Thank you for watching. This concludes the musculoskeletal examination.